first off, we have a question, and it says, over time, a person's metabolism changes, where maybe foods you once could eat, you now can't eat. How often is like a full checkup, one of these full workups that you were talking about, Dr. Ovadia? How often do you need to do that?
Yeah, in general, I recommend that people assess their metabolic health with those basic metrics, at least on an annual basis. And, a lot of it you can be doing, ongoing. Obviously, your waist circumference is something you can check on a weekly basis. Your blood pressure is easy enough to check these days, on a somewhat more frequent basis. And a lot of it's going to be determined by, what you find. If everything checks out okay and you're maintaining the same habits and nothing obvious is changing with your health, then once a year is probably fine. But if everything's not okay, and as you're making these changes to try and improve these metrics, we oftentimes will be reassessing them on a much more frequent basis, every couple of months or so, in terms of the blood work, for instance. So I always tell people the most important step of this is getting started, and, go get that first assessment, go figure out where you are. And then depending on what that first assessment, shows you, is then going to determine how you proceed from there.
Wow, yes, no, that's good advice. And I think, Alan, correct me if I'm wrong, but we tend to want to look at these ventilation systems, at least look at them, or have the report back from the facility manager at about once a year as well, just to make sure that the mechanical systems are functioning well, that there's no obstructions. Is that about right?
Yeah, the industry will tell us, groups like ASHRAE, NADCA, which is the National Air Duct Cleaners Association, would share a similar recommendation once a year to have it inspected. There are some new technologies that we have seen recently whereby the ventilation, you can put probes into the ventilation system to regularly identify particulate conditions, not just particulate, but potential pathogens as well. So it's interesting technology that's coming around. But yeah, it's measuring, being able to measure those conditions are critical